President Yoon Suk Yeol rolled up his sleeves to address the public and the absent trainee doctors on why a medical school admissions hike is necessary. But he also said talks will be available if doctors bring a unified and rational solution to the table. Soo-young starts us off.
The Yoon Suk Yeol administration has hinted there may be room to negotiate with doctors on strike if they can present a solid case for lowering the number of extra students the government wants to add to medical schools each year. This came on Monday as the president made a live televised address to the Korean public to stress the urgent need for medical reform, namely by expanding the quota of students admitted to medical schools by 2,000 annually. The policy has been opposed by some 12,000 junior doctors who've staged the walkout since late February, compromising medical services nationwide, particularly in already underserved areas like emergency and critical care, as well as regions outside Seoul. Doctors have argued that more medical students would lower the quality of education and that improving doctors' compensation would incentivize working in more strenuous healthcare fields. Yoon said there have been sufficient consultations with medical practitioners and experts to decide 2,000 as the minimum number of additional students needed to strengthen the medical delivery system in order to meet the growing demand for healthcare in the rapidly aging country.
지금 당장 5천 명의 의사가 더 필요합니다. 결국 2035년까지 최소한 15,000명의 의사를 확충해야 합니다. 증원에 반대하는 이유가 장래 수입 감소를 걱정하는 것이라면 결코 그렇지 않습니다. 현재 우리나라 의사들의 평균 소득은 OECD 국가들 가운데 1위입니다. 20년 후에 의사가 2만 명이 더 늘어서 수입이 줄어들 것이라는 걱정은 기우에 불과합니다.
Even with 2,000 more enrolled in medical schools, Yoon said it would take about a decade for them to expand the pool of qualified doctors, and at least 20 years for the number of doctors to increase by 20,000. Expressing his regret that the collective action by doctors threatens the lives and well-being of citizens, he noted that some 8,800 now face cancellation of their license to practice medicine.
제가 대통령으로서 앞으로 수많은 국민의 생명을 구하고 또 수많은 국민의 건강을 지켜낼 여러분을 제재하거나 처벌하고 싶겠습니까? 여러분은 대한민국의 매우 중요한 미래 자산입니다. 국민이 여러분에게 거는 기대와 여러분의 공적 책무를 잊지 말아 주시기 바랍니다. 환자가 기다리고 있는 의료 현장으로 조속히 복귀해 주십시오.
Still, Yoon appeared to offer some room for negotiation, saying he is open to discussing appropriate and reasonable alternatives to adding 2,000 extra students, in the form of a unified evidence-based case by doctors, instead of arbitrary and discordant criticism of the government. His policy chief of staff added later in a broadcast interview that it's not about keeping the quota increase at 2,000, but presenting a rational solution that could help steer policy in a better direction.
The president this month will launch a special committee under his supervision to promote dialogue between policymakers and the medical community in order to coordinate and initiate a comprehensive reform. Soo-young, Arirang News.